Hi everybody, this is Dr. Jeffrey from Perceptive Health in Campbell River. We are a naturopathic clinic, and today I wanted to talk a little bit about thyroid and what it means to have low thyroid or subclinical thyroid. So we do see this in practice where people have suboptimal thyroid and they have symptoms of that. So to understand this, we're going to look over the thyroid panel, and that's how we evaluate thyroid, using blood work. Now on that blood work, you can have a diagnosis, you can diagnose thyroid conditions, and you can also find subclinical or nutritional deficiencies that are slowing down the thyroid. So over here, we have just an overview of the metabolism of thyroid. So in the head, in the pineal gland, in the pituitary, we have a hormone that's being released, and that's called TSH. And that stands for thyroid stimulating hormone. So that's kind of being released, and it's knocking on the thyroid, which is located in the neck, and it's saying, let's be active, let's make some thyroid hormone. So the thyroid responds, and it starts producing what we call free T3 and free T4. Those are the two active, or the two forms of thyroid hormone. We have T3, which is the active thyroid hormone, and then we have T4, which is an inactive kind of storage form of thyroid hormone. Now, T3 goes onto the target tissue and it turns up metabolism in that target tissue, so it may increase body temperature, it may decrease body temperature, all these things that happen with thyroid. Then T4, what it does is it has to go and be converted by the liver when it's needed to produce T3. So that's the storage form of thyroid, and it's converted by the liver or the kidney to produce T3. So all those have to be kind of working together to be able to get an optimal thyroid function. And you can see there's some deficiencies that can occur that interfere with production of the active form of thyroid T3. So we see nutritional deficiencies in things like iodine or tyrosine. Those are needed to make the thyroid hormone. We also see deficiencies in selenium and zinc, and those are required to convert the storage form of thyroid hormone into the active form of thyroid. We also see that when there is some sort of a stress going on, a little bit of this T3 gets converted to reverse T3. And that does that under stress. So we can also measure reverse T3, and we can determine if the pool of T3 is actually the active form, or if it's this reverse T3, which is not really very active in the body. So those are the tests that you can run. Naturopathic doctors can run these tests. I can run these tests, and you can get an idea as if the nutrition is influencing thyroid health, and then optimize your thyroid based on that information. So thanks everybody for tuning in. This is Dr. Jeffrey at Perceptive Health in Campbell River.